Good evening, everybody, and welcome to this knowledge series. A very warm welcome to today's very exciting and insightful episode for the knowledge series brought to you by Adhata Trust in association with Tata Marathon Senior Citizens Run. Good evening, everybody, and welcome to this knowledge series. A very warm welcome. My name is Clara D'Souza, and I'm your host and moderator for the day. Today, we'll be taking two important topics. First one is the brain boost, how running supports cognitive health. And as you know, on September 21st, marks the day for World Alzheimer's Day. So I wish to talk on that subject too. So I'm sure my panelist over here will take us through this subject and how physical exercise, particularly walking, running, and few life changes improves our cognitive function, our memory, and overall our mental well-being. So before I begin there, I wish to speak about little about Adhata Trust. Adhata Trust is an NGO working for specially for senior citizens, the older adults, and we generally take 4 topics for the day, for the week also, and we discuss and work entire programs on the holistic well-being of the senior citizen, on the older adult. And the 4 parameters or the dimensions are physical, psychological, social, and mental well-being. And part of this today, this first series that we are taking, the knowledge series, is about mental well-being. And we have here an esteemed panel of experts who will share their knowledge on this topic. I'm sure by the end of the day, we'll have plenty of valuable takeaways. So let me first begin with my friend, Professor Sujata Sriram. It gives me a great pleasure, my dear friends and Adathians, to introduce to you Sujata Sriram. She's a professional, correct? And a professor as well as a dean at the School of Human Ecology at the Tata Institute of Social Science. Professor has been discussing Run for Cognitive Health, how physical activity supports mental well-being and dementia prevention. She will be diving deeper into the relationship between running, mental well-being, particularly in reducing the risk of Alzheimer and dementia. Professor Sujata, welcome today, and I'm sure your experience will help all those watching you, especially the senior citizens, about how and what changes in their life they need to make and what lifestyle changes we will talk about, and especially how this is going to help in their mental well-being. So, dear friends, welcome Sujata Sriram.
Good evening, Clara. Thank you so much for this invitation. Good evening, everybody else who's here. I'm here actually in 3 capacities. First off, as somebody who works with older adults. Second, as an older adult myself. And thirdly, as a runner. And I think here today I'm bringing all 3 hats together, looking a little bit at my own experience with running, which I think I'll start with. I started running actually as a gift to myself when I was 60, which is about 3 years ago. And when I started, I joined a running group, but I also told them that, look, I have no intentions of running in a marathon, okay? Marathons and me don't go together. I'm here only to do fitness. So again, why was I so keen on doing fitness? I had been diagnosed with diabetes a few years earlier. And I'd also been told that, look, you start some physical activity and it will help you in terms of regulating your blood sugar. So that was actually my motivation to join fitness and regulation of blood sugar, but definitely not running a marathon. But that was November 2021. November 2022 was when I first ran my first 10K. And
Oh,
that was actually the Navy run. I'm very happy to say that I placed sixth in a bunch of, I think, 15 or 16 women who were 60 years and above. And since then, I never looked back. I think in the year 2023, I took part in something like 12 10K runs.
oh,
And I also placed in the first three in many of them. So that's actually been the motivator to continue running. So this year, actually, 2024, I haven't run so much. But so my first run in 2024 was the TMM in January, the Tata Mumbai Marathon, which Adhata Trust supports. And again, I am happy to say that some of my students who were studying with me as part of the program on working with older adults were helping Adhata Trust with organizing and actually doing the on-ground support during the marathon. It was a great learning for them, a great learning for me as well, because in terms of looking at how these issues of physical mental well-being can come together and should be encouraged to come together. Adhata has done amazing organizational work in terms of implementing, the run for the senior citizens. And I think this whole process of getting people onboarded, making sure that they arrived at the venue for the run and actually completed the run and felt really challenged and empowered by it. Unfortunately, I didn't compete the run as a senior citizen in the capacity. I did a regular 10K, and this year I'm planning to run 21. So this
wow.
is actually my again my promotion, I guess. So this 2024 is going to see my first 21K run, which is going to be in November. So the same Navy run that I took part in 2 years ago, I'm now going to do the 21K for that. For me, that's been a great learning. For me, the other thing that has helped me a lot is the group of people I run with. I find that, when you have people who are like-minded, who support you. So I'm part of a running group called Striders, which is actually very, very, very supportive. So they train you depending on what the run is that is upcoming. They also tell you about which runs to register for. They also tell you very strictly which runs not to register for. So I was very keen on doing a hill run this year in Satara. There's only a 21K in that. And I was told very firmly by my trainer that you're not going. So then, so I thought, let me listen to him, though I had gone through the initial pre-registration. Uh, I then decided to be, in the side of caution and didn't take part. At various times, I felt, regretful about it, but I keep thinking next year. So that's been my running journey. I will also say that I've had a lot of fun in this kind of a process. And I mentioned the support from the others. So we are a group of about 16, 18 people. It's flexible because people float in and out. We work out 3 times a week, and it's essentially to support you in running. So the aim of Striders is very clearly you're supposed to be running. But alongside, they'll help you do the fitness, they'll do the strength and agility training. So this is where all the cognitive aspects also come in. For example, when you start doing agility and balance and coordination exercises, it actually, you're training your brain. You're training your brain to be more effective, the whole structure. So those are again things that have really helped in the entire ecosystem. Because I'd say that anybody who wants to start running, it's never too late. But just, I would say, make sure that you enroll with a group which can provide the right kind of support for you, which also understands your body, which understands your requirements so that you don't challenge yourself unnecessarily, because injury is something that you need to watch out about. And there's no point, straining yourself and getting injured and then having to stop exercising because of the injury. So that whole process is again a cycle in itself, which can be. avoided if you get in touch with a good support group, which will help you in this journey. But on an average, think about doing some conscious bodily movement. Now I'm coming back to the more serious, hardcore cock science part of it, because a lot of work now from neurosciences looks at the positive impact of exercise on the brain. Directly, there's been a direct connection. A lot of the work comes from people like Wendy Suzuki, who's with New York University. She runs this lab called the Suzuki Lab, and there she's been studying the long-term impact of exercise on the brain. And she has actually documented how when you exercise on a regular basis, and this exercise doesn't have to be running, it's any kind of good physical activity which energizes the whole body. I'm sure Jessica will be telling us more about what happens when we exercise and how to exercise effectively. But when you start exercising, there's this whole flow of things that happen in the body and in the brain. So in the brain, there's this surge of the production of all your neurotransmitters, serotonin, dopamine. So they start to flow. So there's a cocktail of feel good transmitters, neurotransmitters that are bathing the brain. And what has been found is that there is actually a development, a growth of new brain cells. This is actually the newest thing that we've found, that actually there are cells that are there in two areas of the brain specifically, in the hypothalamus and the prefrontal cortex. The hypothalamus is a very important part of the brain for things related with memory, for emotion regulation. The prefrontal cortex is where all the more serious cognitive stuff like, your decision making happens. Um, it's also where all your planning happens. It's where your social behavior happens in terms of, how do you behave in a socially appropriate manner. So exercise has been directly linked with a growth in these two parts of the brain, which are the prefrontal cortex and the hypothalamus. And incidentally, these are also the two parts of the brain that are affected most by your neurodegenerative diseases. So what's happening is exercise is not going to cure dementia, it's not going to cure Alzheimer's, but it's going to give a larger brain for the dementia and Alzheimer's to work on. So which means that there's actually more space, more surface area in the brain, which also then means that you can delay the progress of the illness. And that's actually something which is amazing when you look at you know, what's happening there. So then that's where, when you're looking at all the, when you exercise, you're building muscle. So the muscle that you're building in the brain is the muscle of the hypothalamus and the prefrontal cortex. And both of these are extremely useful for the individual. Now, that said, let's also look at the other effects of exercise. Exercise is directly linked with an increase in the mood, in your feel good factors. Generally, after you've worked out, you've had a good, effective workout, there's this feeling of satisfaction that comes. That's again because of this neurotransmitters, specifically when you're looking at dopamine, which is flowing through the brain. That's the feel good factor that is very, very, very strong. Yes, you will sleep better. It's any movement is useful. So it's not just running that is there. You can walk briskly. I'm not talking about a sedate stroll with friends, which is also nice, but I think at some level we have to think about, getting the heart rate up. And that was actually the kind of thing that I would be more in favor of. So the other things that comes in is when you're looking at exercising on a regular basis, along with elevation of mood, you'll find a decrease of two other things. You'll have a decrease in anxiety and you'll have a decrease in depression. And both anxiety and depression are significant for the elderly. It's actually there's this whole thing that looks at depression as being, one of the major illnesses of the modern age. And sorry. And if you can think of ways of controlling the anxiety and depression, why not? And if it's in your hands to do it through something as unstructured as exercise, why not use it? So how much exercise are we talking about? When I say regularity of exercise, let's think of something that starting up exercising at least 3 days a week. 3 times a week, 45 minutes would be what is necessary. Okay. And again, think in terms of, at what age do you start? The younger, the better, but it's never too late to start. As I told you, I was 60 when I started running. I will continue running for as long as I can. I will also try and run mindfully so that I avoid any kinds of damage. So again, let's also look briefly at what are the kinds of lifestyle factors, because exercise is a lifestyle factor. Okay, and if we say that, look, exercise is a lifestyle factor that can act as a preventive for a neurodegenerative disease, let's also look at what are the other kinds of lifestyle factors that we can control. Smoking is a no-no. If you have smoked, if you are a smoker, would be better to avoid it. Stress is another no-no. So again, try and control stress if possible. Because again, stress linked with anxiety, it's also linked with depression. It's also linked with another lifestyle factor, which is lack of sleep. One of the major problems in the 20th and 21st century is that we have started sleeping very badly. And some of this is because of a substance which we used to think that promotes good sleep, which is alcohol. Incidentally, alcohol doesn't make you sleep better. The first drink may make you feel drowsy and you may sleep off, but pretty soon, alcohol will very quickly change from being a downer to being an upper, which then means that your nerve cells are going to be triggered, which actually then means that you sleep more badly. One of the main things that alcohol affects is what you refer to as REM sleep, the rapid eye movement sleep, which is a very important component of restful sleep. So, those of us who think that, one peg or two won't affect, one peg or two a week may not affect, but let's not try and make it a habit. In fact, increasingly the belief is, look, stopping alcohol completely is probably the route to better old age. If you want to ensure that, we're not going to be prey to any kinds of neurodegenerative illnesses, maybe avoiding alcohol may be one of the best things that you could do. So if you want to drink, there are also certain things that you can do. So for example, can you ensure that you don't drink on an empty stomach? Can you also ensure that you don't drink alone? Because when you drink with others, you generally tend to drink much more slowly as compared to drinking alone. The other thing is, always drink a lot of water after you've had some alcohol, because alcohol is a dehydrating substance. So you actually when you end up with a hangover, that's also because of the fact that your body is dehydrated. So while I say smoking is a no-no, I'm not so no-no about alcohol. I've also mentioned the other lifestyle factors, and obesity is one other thing that, you need to watch out about, so because the more obese you become, the more difficult it is to move, and moving is important. There's this exercise expert who I follow who uses the mantra of, movement is medicine, and I really agree with that. Movement can be medicine, and as long as, we are able to move, we should. I'm going to stop here, and I don't know whether we're going to be taking up questions right now, whether we're going to be taking up questions later.
We'll take questions together. Means we have a good viewership to almost 100 and more on
Oh,
YouTube.
great.
Yeah. So then the questions are coming up. So I think we'll take them up later. But then I just want to, ask you one more question here, Sujata. Is is it too late to, people say, okay, now you are a senior citizen, you must not run, you should
Rubbish.
only walk. So how now if I ask, like if I approach people and say, okay, we are institutional partners and we are doing the senior citizen run this, no, 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 we are not supposed to run at this age. So this is the
So
general response we get. So
Yeah,
this
I
is the age
absolutely
limit for running.
understand that. And some of that is also cultural.
Yes,
Because I would say that in many parts of India, women, especially older women, don't see physical activity or running as a part of being female. So, yoga is okay,
true.
walking is okay, running is not. And that's where I like to see myself as a change agent. So I've, in fact, when I joined the group, I've also brought in another woman who is also who's slightly younger than me. But again, unfortunately, it's just the two of us who are, 60s. Otherwise, there is a lot of resistance, I would say, to older women to run. And I'd say I think, initiatives like yours that looks at how safe running can be done. And that's important, okay? I would say that all of us, before starting to run, needs to get a complete physical health checkup done. Because let's not fool ourselves and think that you can just run 5 kilometers, because you can walk 5 kilometers.
Yes,
The energy expenditure in running 5 kilometers is very different from the energy expenditure in walking the 5 kilometers. So
absolutely.
those are things that we need to look at. But I don't think any age is too old for running.
Absolutely.
And I think we need to pick up exemplars from our own communities where available in order to use them as, role models.
Absolutely. Yes, I think we are already having a role model here. So, taking this ahead, I'll come back to you, Sujata,
Sure.
for our Q&A. And and I think the perfect person now over here should be Dr. Anu Arora. Since we're talking about fitness and we're talking about 60s and we're talking about people who can come in and who can run and what help do you need and what are the parameters that are required. So the next person on our panel, ladies and gentlemen, is Dr. Anu Arora, and she's a professor and head of the Department of Physiotherapy and Community Health at D.Y. Patil University School of Physiotherapy. And Dr. Arora will be talking to us today about joint health, tips for maintaining healthy joints while running or walking. She will explain the impact of running can have on our joints and share some practical tips on how to keep them healthy while we are staying active. So please welcome Dr. Anu Arora. And Dr. Anu, I'm sure you heard Professor Sujata just now, and she said she just started running last year and she's already 60. So we have a perfect example of a senior citizen, of an healthy aging example, and one person who's a motivator and to say, okay, you can start learning is at any age. Learning process doesn't stop with anything with any age bracket. So you can help us to take this forward and give us some highlights and your insights and how joint health is also important for us. Having said that, we can walk marathons, we can run marathons. How do we need to take care of our joints too?
Good evening, and thank you so much for the warm introduction. I must say, I am really honored to be here because you are working in a field which is really close to my heart. And hearing Sujata, I think we are all going in the right direction. So here we have the walk and the talk going together. So I have made a small presentation. I'll take it up ahead with the presentation. It's going to be informal. I'll try to make it as non-medical as possible. So if at any point of time anybody finds there's a term they have not understood or they have a question, please jot it down. So once it is over, we can take that up. Please allow me to share the presentation. Is it visible? Can you see the presentation?
Yes, we can. Yes.
Yeah.
I'll just check it on
Okay.
the YouTube, but I think we can see it.
Okay, great. Okay, so best time to begin the journey of fitness is today. And as I begin this journey, It is not about whether I would be able to finish it or not. It is about taking that first baby step towards realization of the importance of fitness and moving in that direction. Because uh, we need to survive with breathing, but we need to live with fitness. And that is the mantra that we want to propagate today so that everybody is able to go into a successful aging. So when I talk of aging, the aging is something which is inevitable, is it starts once you are born, it starts at the point when you are a zygote in your mother's womb. From there it starts. So there is no stigma attached, it is a chronological process. But aging is associated with some systems changes. We need to acknowledge those changes and make lifestyle changes so that we can, with those changes, we can proceed forward towards a active lifestyle. Today, you are talking of Alzheimer's as I talk of the physical aspects of exercise, especially running. Now, as Sujata mentioned, brain is also a muscle, and like every other muscle in the body, you use the muscle, you increase its strength. You do not use it, you lose its capacity. So, that is a mantra that we must all understand and must always remember. Now, as we grow old, we all tend to accrue wealth. This is not the kind of wealth that we would want to accrue, but we do. The silver in the hair, the gold in the tooth. This is what we want to break. This association of aging with all these conundrums. We want to age like wine, so which grows better as it ages. So that is what is successful aging. And I believe the marathon run that we plan to have in Jan is the first step everybody must take towards getting that successful aging. You asked Sujata about, can everybody run? Yes, everybody can run. I am a physiotherapist. My role is preventive as well as restorative. So I see patients who come to me with pain, but at the same time, I believe prevention is the best strategy. You need not get into the place where you have pain to cure it. You can work before it starts so that the pain does not arise. Any day you begin is the beginning of the journey towards fitness. How do we go by that journey? How we move on that path without pain is what we will see in this. So, before we start up with any physical activity, we have a physical activity readiness questionnaire that we have, which asks some pertinent questions. So, ask those questions to yourself. If you have any chronic medical condition, if I am doing an activity which is vigorous, like running, then I must go and consult my physician who would do a stress test on you and see whether your heart is able to cope with the stress that it would be subjected to with the running activity. Beyond that, you need also to see, so beyond all the basic things, you're looking at your cardiac health, if there is any chest pain, if there's any loss of consciousness, if there's any dizziness. Well, if any of these is true, you have to visit your doctor before you start your exercises. Any kind of activity that you are not accustomed to. Beyond that, in case you have a fever, you're not feeling well, you have a cold, there is some change in the response to the activity that you're using, please do not continue. Go and meet your physician, take his advice. I mentioned prevention is better than cure. I stick to that adage here also. So, exercise can benefit. We start the session with this that exercise can harm too. So, we should be cautious and we should be able to read the signs where exercise can be of any harm to me. So, that is very, very important. As a physician, as doctors and physiotherapists, the first rule that we are taught is primi non nocere. First, no harm. So, when we take you, we motivate you on this journey to fitness, the first thing that we need to take is to prevent any harm from coming. And that is what you do here. Once you have cleared up this step, then we proceed to what to understand. What does aging do to my systems? Your body is like a machine. You keep a machine in home and you don't use it, even if that machine is a treadmill. You start it after 2 years. Now suddenly I want to run on the treadmill. Yeah, your body will refuse to comply with your demands. Your machine will also refuse to comply with your demands. The same principles are applying in both the machines. You use it or you lose it. So whether it is your physical health or your mental health, if you don't work upon it, you do not challenge, you do not take up something novel, the capacity, the physical and the mental capacity will decline with time. We use the term sedentary death syndrome. We say if you don't move, if you are sedentary, you are actually accelerating that movement towards mortality. I believe I'm dramatizing it, but then it is as important. Now, when we look at normal aging process, this is normal, this is physiological, it happens with everybody. If it does not happen, then it would be considered abnormal. So we need to appreciate what are the changes taking place and then take steps so that those changes do not harm me as I take up a new activity. The first change that I need to understand is my bone health. It reduces with age. For females, it becomes even more significant because after menopause, when you lose your estrogen, your body starts leaching out the calcium. This calcium is coming from the bones. The bones now become more porous. Anything which is less porous, less dense, it tends to give way when it is subjected to any kind of stress. And this is what we call fractures. So your chances of getting a fracture when you fall as you age is increasing. Apart from that, you see some changes which are occurring in your posture also. You see older people, they tend to be stoop. That is also coming because your vertebral bodies are also losing on their calcium. Then a very common functional sign that we associate with aging is painful knees. Most common complaint. So this is coming because your muscles are getting weak, the cartilage, the झिल्ली जो आप घुटने के बीच में बोलते हैं झिल्ली होती है, वो झिल्ली आपकी उम्र के साथ घिस जाती है, जिसको आप बोलते हो मेरे जॉइंट्स घिस गए। आपके जॉइंट्स नहीं, आपकी झिल्ली घिस गई है, जिसकी वजह से हड्डी जो है एक दूसरे के साथ फ्रिक्शन, घर्षण प्रोड्यूस करती है, जो आपको पेन देता है, इन्फ्लेमेशन आता है। So this is a normal sign of aging.
Yes,
See, the
Doctor, thank you
degeneration of
for
the
talking in Hindi. I think in YouTube, some people are continuously telling me, please let's explain little in Hindi also. Please.
yes,
Thank
yes.
you so much.
तो yeah, तो हमारे घुटनों का दर्द आपको एक कॉमन तकलीफ है ना। घुटनों का जो घिसना है वो नॉर्मल है, लेकिन दर्द होना नॉर्मल नहीं है। आप घुटनों के घिसने को बंद नहीं कर सकते, आप दर्द का निवारण जरूर कर सकते हैं। उम्र के साथ आपके स्नायु, आपकी मांसपेशियां या मसल्स, दे ऑल्सो गेट वीक। then your heart becomes weaker, so it cannot take extra load. Your breathing capacities, आपके फेफड़ों की जो सांस लेने की क्षमता है वो भी कम हो जाएगी। आपकी ब्रेन हेल्थ कम हो जाएगी। कितने सारे लोग ये देखते हैं कि 55 की उम्र के बाद सडनली ऐसे लगता है कुछ नाम भूल रहे हैं, कुछ कहीं रख देते हैं तो याद नहीं आता है, किसी से बात कर रहे हैं, मैं क्या बात कर रही हूँ भूल जाते हैं, और धीरे धीरे ऐसे लगता है कि ये एपिसोड्स बढ़ते जा रहे हैं। इसको हम बोलते हैं माइल्ड कॉग्निटिव इम्पेयरमेंट। जब तक ये माइल्ड कॉग्निटिव इम्पेयरमेंट है तब तक हम इसको टैकल कर सकते हैं, पर इसके बाद जब वो डिमेंशिया और अल्जाइमर्स की तरफ चले जाए तब हम इसके लिए कुछ नहीं कर पाते। लेकिन अच्छी बात यह है कि ये चेंजेस हो तो रहे हैं, लेकिन इन चेंजेस की वजह से हमारे जीवन में जो रिस्ट्रिक्शंस आ रही है उसको हम बहुत हद तक कम कर सकते हैं। अगर हम वो कम नहीं करते हैं, ये सारे चेंजेस ऐसे ही आते हैं, सो ऑल दिस पेन, ऑल दिस रिस्ट्रिक्शन ऑफ मूवमेंट, ऑल दिस फॉरगेटफुलनेस, इवेंचुअली what it does is it isolates us. You stop going out because you don't want to. You don't want to face this. I have pain when I go out. I forget when I go out. I feel breathless if I have to go to the market. And that makes you lonely. And there come all those mental problems which are associated with aging, what we call as depression and anxiety. So when we exercise, what does it do? Especially because we are talking of running today. What does running do? Running helps me to control my chronic diseases. अगर मैं किसी भी तरीके की physical activity, especially running, because running is a vigorous activity which activates your heart, which activates your muscles, puts that load on your joints and your muscles so that they remain in the healthy condition. इसलिए रनिंग करते हैं तो हमें बहुत सारी तकलीफें जो नॉर्मल एजिंग के साथ आती हैं, हम उनको रोक नहीं पाएंगे, हम एजिंग को नहीं रोक पाएंगे। मैं झूठ बोलूंगी अगर मैं कहूंगी कि आप भागे तो आप हमेशा यंग रहेंगे। आप यंग नहीं रहेंगे, लेकिन आप सुजाता जैसे जरूर रह सकेंगे। आई हैव अ रोल मॉडल टुडे विद अस, सो आई कैन टेल यू योर रिस्क। शी मेंशन डायबिटीज, so her running, I'm sure, must have helped her to control her blood sugar levels. It helps you to control your diabetes. It helps you to control your weight. क्योंकि जब हमारी उम्र होती है तो उम्र के साथ हमारी मांसपेशियां तो कम हो जाती हैं, लेकिन शरीर में जो फैट की, वसा की मात्रा है वो बढ़ जाती है। जब मैं भागती हूँ या किसी तरीके की ऐसी एक्सरसाइज करती हूँ, तो मैं अपने वजन को भी कंट्रोल में रख सकती हूँ। हम बोलते हैं वजन में हमारे दो इंपॉर्टेंट कंपोनेंट्स हैं, एक मेरी मांसपेशियां और दूसरी तरफ फैट। मांसपेशियों के साथ मेरे बोन्स भी आ जाती हैं, हड्डियां भी। व्हेन आई एक्सरसाइज, व्हेन आई रन, मेरी मांसपेशियां और बोन्स दोनों हेल्दी हो जाते हैं, तो इनका वजन बढ़ जाता है। और फैट जो खराब है, जो मेरे को दिल की बीमारी भी देने वाला है, उसका वजन कम हो जाता है। तो भागना आपको ड्यूअल बेनिफिट दे रहा है, आपकी हेल्थ को बढ़ा रहा है, और जो चीजें हेल्थ को खराब कर रही है उनको वो कम भी कर रहा है। इसके साथ साथ बहुत सारे कैंसर्स हैं जो आपके वजन के साथ एसोसिएटेड है। तो जब आप एक्सरसाइज करते हैं, व्हेन यू रन, यू डिक्रीज द रिस्क ऑफ दीज कैंसर्स ऑल्सो। Beyond that, you also improved your mental health because, as Sujata mentioned, yes, research is very, very categoric about it, that when you exercise, you increase something which is known as brain-derived neurotropic factors. And these are very important because they help to decrease the process of aging. So, aging, when I say aging, I am not talking of white hair. I am not talking of dental problems. I am not talking of wrinkles in your eyes or sunken eyes. I am talking of fitness. I am saying, yes, the number of candles on your birthday cake will increase because that nobody can stop. तो आपकी उम्र का नंबर तो बढ़ेगा, लेकिन आप अपनी उम्र से बहुत ज्यादा काम कर पाएंगे। आपकी स्लीप अच्छी हो जाएगी, आपका जो वेल बीइंग है वो अच्छा होगा, डिप्रेशन नहीं होगा, एंजाइटी नहीं होगा। You would have energy to go out, meet up with friends, go for the marathon, feel good after completing the marathon, meet up with your friends and put that status in your social media pages that that is what I want to do. And overall, what it will do is it will increase your satisfaction with life. So when I say I am XY years old, I would mean it is not just the number of years which is adding up. I am living those years to the fullest. So there are some specific benefits which we see with running in senior citizens. Do you identify these pictures on the right side? You see here Milan Soman with his mother. Milan Soman is approaching 60 and his mother is 80 plus. And beneath here, we have two of the eldest marathon runners of our country. They are centennials. And this they could achieve because of the health benefits they could have because they were running. Another thing that you see here on these runners in these pictures is they're all erect. Look at their postures. They're all erect. They're not stooping. They look healthy to you. This running that they do in any kind of place, whether they are doing it for recreation or competitive, it helps them walk better. और आपका जो चलना है, आप जिस तरीके से चलते हैं, आपकी वॉकिंग की कैपेसिटी इज अ वेरी इंपॉर्टेंट इंडिकेटर ऑफ योर हेल्थ, ऑफ योर वेलबींग, ऑफ योर लॉन्जेटिविटी। जो जितने इरेक्ट और सीधा और अच्छा चल पाते हैं बिना बैलेंस को लूज किए, वो हेल्दी तरीके से लंबे समय तक जी भी पाते हैं। So how do we begin with this? How do we begin? If if you have been running, very good, then you can continue. As Sujata mentioned, 3 times in a week. What ACSM says, ACSM is the American College of Sports Medicine. When they are the pioneers on all the research which has been done on exercise physiology. तो उन्होंने जो अपनी रिसर्च किया है उसमें उन्होंने बोला है कि अगर आपको कोई भी बेनिफिट चाहिए, जो आप एक्सरसाइज कर रहे हैं, जो एक्टिविटी कर रहे हैं, उससे अगर आपको बेनिफिट चाहिए तो कम से कम 3 बार हफ्ते में आप वो एक्टिविटी जरूर करेंगे। ये एक्टिविटीज क्या होंगी? स्ट्रेंथ ट्रेनिंग एक्सरसाइजेस, स्ट्रेंथ ट्रेनिंग 2 to 3 times in a week. Why? Because जब आप स्ट्रेंथ ट्रेनिंग करते हैं तो आप थोड़ी इंजरी करते हैं बॉडी में, तो बॉडी को उससे रिकवर करने के लिए थोड़ा टाइम चाहिए, इसलिए इसको हम लिमिट करेंगे. एरोबिक एक्सरसाइजेस लाइक वॉकिंग, long distances, you can do it 5 times in a week. Some people who are just starting, they are deconditioned, उन्होंने पहले ये कभी नहीं किया है, उनके लिए हम एडवाइस करते हैं कि आप थोड़ा एक्टिविटी करिए. स्टार्ट विद वॉकिंग and then proceed to running. Don't start with running to begin with, and increase the duration of running slowly over a period of time. Don't make a sudden change in your body. Let the body adapt and then move ahead. Get yourself an exercise buddy. Now, exercise buddy means आप एक दोस्त के साथ, एक फ्रेंड के साथ साथ में एक्सरसाइज करिए. इसके बहुत सारे बेनिफिट्स हैं. एक तो देर इज अकाउंटेबिलिटी. हर रोज अगर आप सुबह कर रहे हैं एक्सरसाइज, तो कोई है जो सुबह आपको जगा रहा है और बोल रहा है आज चलो. अगर आप एक दिन नहीं गए तो वो आपको बताने वाला है कि आप नहीं गए. Then this the buddy who has the same kind of motivation is also going to motivate to do better. And then it is a safety parameter also, because when you are doing an activity like running, somebody must be there to see that everything is going fine. Give yourself time. Be a little gentle with yourself and your body. Love your bodies. We say self-love is the best kind of love. Love your bodies because this is the only place you have to live in. This is your only companion right from your birth till your last breath. So this is the companion that you should listen to the most. When you start with a new activity, हम कुछ भी नया करते हैं, उसको सीखने में समय लगता है. तो ये समय अपने आप को दीजिए, जल्दी मत करिए. कुछ भी चेंज अगर महसूस होता है, then talk to your doctor, your physician, so that they can see those changes and give you advice accordingly. Set smart and realistic goals for yourself. And very, very important, remember to rest. जब भी आप कुछ एक्सरसाइज करते हैं, जिसमें मैंने बोला स्ट्रेंथनिंग एक्सरसाइज कर रहे हैं, वेट कर रहे हैं, रेस्ट करिए ताकि बॉडी रिकवर हो सके और फिर वहां से अपने आप प्रोसीड करे. When I'm talking of training, we say there are 5 domains of health related fitness. So your training must take care of all these. First thing is flexibility. See that आपके स्नायु में लचीलापन है, आपके जॉइंट्स में मूवमेंट है. जब मूवमेंट होगी उसके बाद हम वहां से स्ट्रेंथनिंग की तरफ जाएंगे. ये लचीलापन जरूरी क्यों है? क्योंकि अगर फ्लेक्सिबिलिटी है, योर चांसेस ऑफ इंजरीज गो डाउन. इफ योर मसल्स आर टाइट, then the chances of musculoskeletal injuries when you do any kind of exercise is more. So that is the first thing that you should take care of. Your body composition. I already mentioned about weight. When I say body composition, my body is made up of fat, my body is made up of muscle. Try to decrease the fat and increase the muscle which is present in the body. Increase the strength of your cardiovascular system, that is your heart, your lungs. That is how the body will get the energy to do the activity that you are doing. All these are very, very important. And when you are doing this, also see to it that you are decreasing the amount of sedentary activity. Take up an activity of your choice. It could be a dance, it could be run, it could be playing, anything. Take what you want to do and proceed slowly, because it's slow and steady which would win the race. Rome wasn't built in a day. So you cannot become a marathon runner also in a day. If you've taken that first step towards wanting to do it, that is the beginning. Now slowly take it up from there. You don't have to just land on the road for running. You also have to see that you have the adequate strength to take, and your heart has adequate strength to take up the load of running before you hit the road for running. So those things you need to take care of. Some things that happen. See, injuries happen. You want to prevent injuries, but it is not always possible to prevent injuries. So take all the safety measures. But if the injury happens, then consult a specialist. See that you do complete recovery from the injury and then go back and join running. Some common injuries that we see in runners are pain in the knee, then pain on the side of your leg, घुटने का दर्द जिसको आप ऑस्टियोआर्थराइटिस ऑफ नी बोलते हैं, नी कैप के नीचे दर्द आना, लेग के साइड में दर्द आना जो इलियोटिबियल बैंड में दर्द है, शिन पेन विच इज वेरी वेरी कॉमन, पेन इन द हील जिसको हम प्लांटर फेशियाइटिस बोलते हैं, जो टिपिकली आप सुबह जब उठते हैं पहला कदम बेड से नीचे रखते हैं तो बहुत तेज दर्द होता है, लेकिन कुछ देर चलने के बाद थोड़ा ठीक लगता है. इसको हम बोलते हैं plantar fasciitis. So all these are some common injuries that we see in runners. There's always a cause for injury. That cause could be your body mass index, excessive weight, because जितना weight होगा उतना ground reaction force होगा, उतना आपके joints पे stress होगा. आपका रनिंग एक्सपीरियंस एंड वॉल्यूम, आपने सडनली बहुत ज्यादा भाग लिया तो भी रनिंग आपको ऐसी इंजरी हो सकती है. Then wrong shoes. Shoes is a very, very, very important thing that you have to see when you are doing running. Running is a high impact sport where what happens is when you put your foot down, there is compressive force which is coming on your knee. तो जो आपने जमीन पे पांव रखा उसकी वजह से ग्राउंड रिएक्शन फोर्स आया, उसने आपके जॉइंट को कंप्रेस किया. इसकी वजह से आपको पेन, आर्टिकुलर कार्टिलेज का डीजनरेशन हो सकता है. तो इसके लिए मुझे सही, जब मैं जूते लेती हूँ, वो जूते मेरे को शॉक अब्जॉर्प्शन में, वेट डिस्ट्रीब्यूशन में हेल्प करते हैं. अभी जूते कैसे लेने का, सब लोग एक तरीके के जूते नहीं पहन सकते क्योंकि हम सबके पाँव अलग अलग तरीके के हैं. तो हमको सबसे पहले अपने पाँव को जानना है कि मेरे फीट कैसे हैं. एक छोटी सी टेस्ट है जिससे आप पता कर सकते हैं कि आपका पाँव नॉर्मल है, फ्लैट है या हाई आर्च है. पानी में अपने पैर को डिप करें और उस पैर से किसी कार्डबोर्ड पे या पेपर के ऊपर ऐसे खड़े हो जाइए जैसे यहाँ पे आप देख रहे हैं. एंड वंस यू स्टैंड, नाउ गेट ऑफ द प्लेस एंड सी कि आपके पैर के जो फुटप्रिंट्स हैं वो कैसे बने हैं नीचे. फुटप्रिंट्स का हमने क्या देखना है कि उसका जो बीच का पार्ट है वो कैसा है. अगर वो बीच का पार्ट ये पहले फिगर में जैसा आपको दिख रहा है, हर जगह से पाँव नीचे जमीन के कांटेक्ट में आया है, तो ये आपको बताता है कि आपका फ्लैट फुट है. अगर आप ऐसा रखते हैं और ऐसा आर्च बनता है, दिस इज अ न्यूट्रल, अ नॉर्मल फीट. एंड देन इफ दिस कर्वेचर इज दिस हाई, ऐसा इम्प्रिंट जो तीसरे फिगर में है, तो इसका मतलब आपकी आर्च ऐसा ऊपर है. जिनका फ्लैट फीट है वहां पे जो अंदर की साइड आर्च है वो ऐसा पूरा नीचे चला गया. तो आपका जो जूता है वो आपके आर्च के हिसाब से होना चाहिए. जूते का फंक्शन क्या है कि वो हमारे वेट को इक्वली डिस्ट्रीब्यूट करे, किसी एक पॉइंट पर ना आने दे, ग्राउंड रिएक्शन फोर्स को कम करे, शॉक अब्सॉर्प्शन करे. तो ये फंक्शन वो हमारे पैर के हिसाब से अगर होगा तभी कर पाएगा. तो आप ये खुद से ऐसा जांच कर सकते हैं. इसके साथ ही आप ये किसी पोडियाट्रिस्ट से या फुट एक्सपर्ट से भी कांटेक्ट कर सकते हैं या फिजियोथेरेपिस्ट से कांटेक्ट कर सकते हैं, जो आपको आपका फुट का जांच करने के बाद बताएंगे आपका ऐसा पैर है तो इसको इस तरीके का जूता चाहिए. देन हम जूता जनरली ले तो लेते हैं लेकिन उसी जूते के साथ फिर साल दर साल चले चले जाते हैं. दैट इज अ मिस्टेक. हमारे क्योंकि इतना जब लोड आ रहा है जूते पे तो उस पे वेयर एंड टेयर होगा. सो दैट मीन्स दैट वेयर एंड टेयर विल इट विल डिस्टर्ब द फंक्शन ऑफ द शू. So you should change your shoe regularly. We generally say 6 to 7 months of running is a ideal period where your shoe should be changed. And whenever you are buying a new shoe, when जब मैं नए नए जूते में पाँव रखती हूँ तो पहले एक दो दिन वो थोड़ा चुभता है, थोड़ा लगता है. तो वो इसलिए हो रहा है क्योंकि वो अभी जूता फ्लेक्सिबल नहीं हुआ है. तो उसको फ्लेक्सिबल होने में थोड़ा टाइम लगता है, तो उसको उस प्रोसेस को थोड़ा स्लो, थोड़ी थोड़ी देर के लिए पहनी. सीधा नया जूता रनिंग के लिए मैं उसी दिन उसको इनॉग्रेट करूंगी तो वो मुझे बहुत लगने वाला है और मैं एंटीसिपेट भी नहीं कर पाऊंगी कहाँ पे वो मुझे चुभ रहा है कि बराबर है कि नहीं. एक और चीज जो हमें ध्यान रखनी होती है जूता लेने में, यू बाय योर फुटवेयर इन द इवनिंग, नॉट अर्ली इन द मॉर्निंग. देर इज वाटर रिटेंशन विच अकर्स इन योर फीट. तो आपके पैर का जो साइज है वो सुबह और शाम में थोड़ा सा चेंज होता है. अगर आपने सुबह के टाइम में जूता खरीदा और बाद में शाम को उसको पहन के आप बाहर निकले तो आपको लगता है ये तो टाइट हो गया, पर खरीदा तो मैंने ही था. वो इसलिए क्योंकि पैर का साइज चेंज हुआ है. सो इट इज एडवाइजेबल टू बाय योर शूज इन द इवनिंग rather than early in the morning. These are some shoes that I have put here depending upon the type of your feet. So if you have a normal feet, then what you require is cushioning, cushioned sole, a stable base. So ये पहले दो जो जूते आपको नजर आ रहे हैं ये नॉर्मल फीट के लिए हैं. अगर आपकी हाई आर्चेस हैं ऐसा ऊपर, जिसको हम पेस्केवस बोलते हैं, तो ऐसा कुशनिंग वाले जूते आप लेंगे. ये कम कॉमन होते हैं हाई आर्चेस. ज्यादा कॉमन होते हैं नॉर्मल और उससे ज्यादा फ्लैट फीट। फ्लैट फीट अगर है तो आपका पाँव ऐसे बाहर की तरफ जा रहा है, जिसको हम बोलते हैं ओवर प्रोनेशन। और इसकी वजह से आपके एंकल के स्प्रेन होने के चांसेस भी, अगर उसको बराबर सपोर्ट नहीं है, ज्यादा हो सकते हैं। आपके पाँव में थोड़ी देर के बाद आपके नॉर्मल जूते में आपको दर्द महसूस हो सकता है। तो ऐसे में मुझे ऐसा जूता चाहिए जो मेरी हील को बराबर से पकड़ के रखे, मेरे मीडियल आर्च को, जो नीचे कोलैप्स हो गई है, उसको हील आर्च सपोर्ट दे, और मेरे पैर में भी टो बॉक्स थोड़ा वाइड रखे, नैरो ना रखे, ताकि उंगलियों के लिए बराबर से जगह हो सके। ये बेसिक इंफॉर्मेशन है। यहाँ मेरा ऐसा गोल नहीं है कि आप सब एक्सपर्ट्स हो जाएंगे, लेकिन आप आइडेंटिफाई कर पाएंगे कि मुझे ये प्रॉब्लम है, तो मुझे इस एक्सपर्ट से एडवाइस लेनी चाहिए। दैट इज द टेक होम मैसेज दैट आई वांट यू ऑल टू टेक फ्रॉम हियर। तो अगर मुझे फ्लैट फुट है, अगर मैं उसको आइडेंटिफाई नहीं करूंगी, पाँव में थोड़ा चलने के बाद दर्द होता है, मुझे पता ही नहीं चलेगा, तो मैं ठीक एडवाइस कैसे ले पाऊंगी? तो ये आप यहाँ से इंफॉर्मेशन लेकर के चाहिए। So then, running is important, training is important. Yes. What is also important is recovery from that running. जैसे मैंने बोला, हम एक्सरसाइज करने के बाद सोना बहुत जरूरी है। सुजाता जी ने बोला आपको आरएम स्लीप बहुत जरूरी है। तो उसी तरीके से रनिंग, जिस दिन मैंने एक्सरसाइज किया उसके बाद मुझे रिकवरी की भी जरूरत है। उस रिकवरी की भी हमको ध्यान रखना है। रिकवरी हम कैसे करेंगे? हमने एक्सरसाइज करने से पहले वार्म अप किया, हम उसके बाद में कूल डाउन करें, हाइड्रेशन का ध्यान रखें, post workout nutrition, whether it is carbs or proteins, with the help of a dietitian, work that out. Don't stop moving. एकदम से रुक मत जाइए। रिकवरी टूल्स जैसे हॉट वाटर बॉटल्स और कोल्ड पैक्स, फोम रोलर्स, इन सब का हम इस्तेमाल कर सकते हैं, ताकि हमारे मसल्स में जो स्ट्रेन आया उसको हम रिकवर कर सके। एंड फोकस ऑन योर स्लीप, see that you have enough time to sleep. We were talking about, if you have pain, can you walk, can you run? You can absolutely run. So there is research now, बहुत सी रिसर्च की गई है जिसमें ये पाया गया है कि जो लोग रनिंग करते हैं उनके आर्टिकुलर कार्टिलेज, झिल्ली, जो मैंने बोला घिस जाती है आर्थराइटिस के साथ, रनर्स की झिल्ली अच्छी कंडीशन में रहती है कंप्रेसिव लोड होने के बावजूद, क्योंकि उनकी मांसपेशियां इतनी स्ट्रांग होती हैं कि वो ऑफलोड कर देती हैं। रनिंग के जो और बेनिफिट्स हैं, वो कंप्रेशन का जो एक हार्म आपके जॉइंट पे आ रहा है उसको बिल्कुल कम कर देता है। तो बेनिफिट्स ऑफ रनिंग आर मच मोर देन द एनी पोटेंशियल हार्म, and harms you can take care of if you look at some of the things. See to it that when you're running, your form is proper, you're wearing good shoes, when your foot is being placed, it is behind your knee and not ahead of your knee. Train properly, give strength training, and see that you're erect when you're running. If even after this you find that you have some problem with running, meet an expert so that they can take care of these things. So it is a journey of 1,000 miles, which will begin with a single step. First step is to pledge that this is what I want to do. Then you go to train, set up the goals, and happy learning for all of you. So I'll finish my presentation here. This is a picture of the people that we are in contact with. We call them the aging warriors. They are in action. And if you see, all of them are erect. All of them exercise for 1 hour every day. They meet up, they take care of your physical health, of the mental health. Thank you so much. Please keep your questions handy and we can take it up later.
Thank you, Dr. Anu. This was really it's an eye-opener for all those who want to do the marathon this year. Just not that how you need to start your training now itself, even if your marathon is in Jan, and you really need this time span, to reach there, and then only your goal is achievable. You can just not start running 1 week before and then run the marathon. How slow and steady you need to do this, and how this is very helpful. So thank you so much, and I think we can come. There are many Q&As. We have more than 150 viewers, and वो सब YouTube में questions really flooding, but हम सब साथ में लेते हैं. So now is Jessica online? Jessica? Yes.
Can you hear me?
Hi, Jessica. So the next speaker for our day is Jessica Philip, and she is a regional leader in minimalist ultra running in Mumbai, a level 2 animal flow instructor. And Jessica is also an engineer at JP Morgan Chase, and she'll be sharing expert advice on how to train effectively for a marathon. And Jessica brings a wealth of experience from the world of endurance running, and I'm sure her insights will be incredibly useful to those who are looking to take this running to the next level. So, dear friends, and all those who are watching us, please welcome Jessica. And Jessica, you heard Sujata, you heard. You have a role model, then you have somebody talks about joint health to you, and say how I saw how this complemented. And I think you can sum this up for us because you are the marathon runner now.
So, first of all, I would like to thank you for inviting me. And I've heard Professor Sujata and Dr. Anu, and I think they've mentioned everything that I had to mention. They mentioned it so eloquently. तो मैं कुछ ही चीज़ बताना चाहूँगी यहाँ पे कि I know your audience, if your audience contains senior citizens mostly, और काफ़ी लोग ऐसे सोचते हैं कि एक एज होता है रनिंग के लिए. दैट इज़ एब्सोल्युटली नॉट ट्रू. द वे Sujata said, the way when Dr. Anu mentioned that not just running, there is no age for doing anything. Okay, you can see nobody's asking you to be an Usain Bolt at the age of 60, but whatever your age can support you with, you can do it. तो रनिंग में कैसे होता है रनिंग में देर आर डिफरेंट टाइप्स ऑफ रनिंग there are road races, there are dream runs, there are senior citizen runs, there are there are fun runs, which are 2 kilometers, 3 kilometers, 4 kilometers. So running as a sport can be enjoyed by anybody and any age. लेकिन जो चीज़ है about running, it's considered a high impact sport. No matter what speed you're in, you're always putting one foot and the other foot and the other foot. You're always on one foot. It's a single leg activity per time. So the strength demands for running are quite high as compared to walking. और यही जो चीज़ है which is extremely important for senior citizens, particularly क्योंकि as we age, अपना जो the conditions that we come across, things like orthopedic conditions, osteoporosis, all of these can be dealt with running, any high impact sport. और running एक ऐसा sport है which is actually the easiest sport to take in your old age, really easiest sport. Running में क्या होता है, you just have to put on the right shoes and you have to get out and you have to put one foot ahead of the other, one foot ahead of the other. So as a skill, it's actually a very very easy skill to learn. तो काफी लोगों को ऐसा लगता है कि रनिंग इज वेरी हार्ड. ट्रस्ट मी, रनिंग इज द इजीएस्ट हाई इम्पैक्ट स्पोर्ट यू कैन टेक ऑन योर बॉडी. तो एक चीज आप ये दिमाग से हटा दो कि रनिंग इज नॉट मेंट फॉर ओल्ड एज. एनी वन एट एनी एज कैन पिक अप रनिंग. दूसरा जो चीज है, एंड आई वुड लाइक टू add a little more to what Dr. Anu had provided very beautifully in her slides, as to how runners, जब हम एक सीनियर कैटेगरी में आते हैं, how they have to train. तो दे हैव टू ट्रेन अ लिटिल डिफरेंटली, इनफैक्ट अ लिटिल मोर कॉशियसली. तो उनका जो वार्म अप, उनका जो कूल डाउन जनरली थोड़ा ज्यादा लंबा रहता है, बिकॉज वी रियली नीड टू गेट आवर जॉइंट्स ग्रूवी इन ऑर्डर टू टेक ऑन द स्पोर्ट. और अपना जो रिकवरी इज वेरी मच अ पार्ट ऑफ अ सीनियर सिटीजन रनर्स प्लान. इट्स वेरी मच अ पार्ट ऑफ द ट्रेनिंग प्लान. वी टेक रिकवरी एक्सट्रीमली सीरियसली एज वी एज, क्योंकि आपका जो स्लीप है, दैट्स द ओनली टाइम यू विल बी एबल टू रिकवर फ्रॉम अ हार्ड एफर्ट. So recovery is extremely important for a senior citizen runner. And the other thing that I would like to mention, um, this word masters. Do you know this? I don't know whether your audience knows this. Senior citizens ke liye, anyone, at least in endurance sport, anyone above the age of 40 is considered a masters runner. If you're from track and field, the age bar is even lower. It's generally 35 for international track and field events. So we are already aging, no matter what. Even if you have reached your 35, you've started aging. So don't feel that you are in a different category altogether. Everybody's aging. Age is a natural process. It is something that we all have to deal with, but it is a phase of life, and you have to embrace this phase of life with whatever it brings to you. So, masters, there is a, ये जो word है, it itself means something. That you're a master at something, and masters generally means that you have accumulated a lot of experience in something. Or personally, as a coach and even as an ultra runner myself, I have seen so many मास्टर अल्ट्रा रनर्स. अभी अल्ट्रा रनर्स जो है, अल्ट्रा रनिंग इज वेरी वेरी कॉम्प्लेक्स स्पोर्ट. इट्स रनिंग मोर देन अ फुल मैराथन. And I can speak of one master ultra runner whom I know personally, Taruma Teti. She's from Pune, and I'm sure our panelists know her as well. She she's in her 60s and she runs marathons for breakfast. Uska wo level hai. She's in her 60s and she creates records in the 100 milers at this age. Something that even I can't create at the age of 40. So there is nothing that can stop you. That is what I'm trying to say. Nothing that can stop you. All that you need is good training. You need good training. You need good recovery. You need a good coach. प्रोफेसर सुजाता ने एक चीज मेंशन किया है और बार बार मेंशन किया है कि यू नीड अ कम्युनिटी. एंड इसका एक इम्पोर्टेंस रहता है कम्युनिटी के लिए, क्योंकि क्या होता है whenever people take up running, कोई भी, whether you're new to the sport as a youngster और आप सीनियर हो, the first instinct is to go online. और अभी तो एआई भी आ गया, चैट जीपीटी आ गया. यू कैन जस्ट लिटरली चैट विद द एआई इंजन एंड से कंस्ट्रक्ट अ ट्रेनिंग प्लान फॉर मी. आई एम एन एज 60-year-old रनर, एंड इट विल जनरेट अ ट्रेनिंग प्लान फॉर यू. बट वो जो चीज है, इट्स कॉल्ड अ कुकी कटर प्लान. इट डज नॉट नो एनीथिंग अबाउट यू. लेकिन आपका जो रनिंग कम्युनिटी है, आपका आपका जो कोच है, यू हैव टू स्पेंड टाइम विद द कोच एंड द कोच हैज टू स्पेंड टाइम विद यू. आपको आपके लाइफ को अंडरस्टैंड करने के लिए बोथ ऑफ यू ऑल नीड टाइम. और कैसा रहता है कि वी एज ह्यूमन बीइंग्स, स्पेशली वंस वी हैव पास्ट अ सर्टेन एज, पास्ट द एज ऑफ 40, काफी रिस्पॉन्सिबिलिटीज होती है, वर्क रिस्पॉन्सिबिलिटीज, होम रिस्पॉन्सिबिलिटीज, और उन रिस्पॉन्सिबिलिटीज के बीच में वी हैव टू एडजस्ट आवर ट्रेनिंग. So how will an AI engine know about your life? But a coach and your community definitely know about your life. और उसके हिसाब से they will try to formulate a training plan that can fit your life and can fit your circumstances. अभी just before this call actually started, so Clara was asking me, "Oh, do you work for JP Morgan Chase?" And I said, "Yes, I'm working." She said, "When do you get the time?" So I was telling her कि every day is different. I really cannot say कि tomorrow मेरा time कैसा होने वाला है. Wherever I have time in my calendar, that's where I go and train. So it is, for me, my days are never fixed. काफी लोगों के लिए उनका एक privilege रहता है कि every day they can train at a certain time. Some people, busy people, the busier you get, the less this privilege becomes. But it can be done. और मैं क्या करती हूँ, स्पेशली इफ यू गॉट लॉट ऑफ थिंग्स ऑन योर हैंड, समटाइम्स आई इवन स्प्लिट माई ट्रेनिंग माइलेज. तो इफ आई कैनॉट डू अ सर्टेन डिस्टेंस, अगर लेट्स से आई कैनॉट डू 20 kilometers एक साथ, आई स्प्लिट माई माइलेज. मे बी आई डू वन 10 kilometers on the day before, 10 kilometers the day after, or I will do one in the morning, one in the evening. ऐसा कुछ I will adjust. So in my case, I'm coaching myself, but if I'm coaching someone else, then I will know what their life is. और उनके life के हिसाब से I will plan the training for them. But everything is plannable, everything is trainable. Human body जो है, it is highly adaptable at any age. But you need वो जो बोलते हैं tincture of time चाहिए. I would say at least give yourself at least 3 months to get acquainted with any sport. और अगर आप नए हो ये स्पोर्ट में, तो आपके एडवांटेजेस ज्यादा है, बिकॉज योर लर्निंग विल बी क्वाइट फास्ट. इनफैक्ट जो लोग काफी फिट रहते हैं, दे हैव टू वर्क अ लॉट हार्डर टू गेट मोर गेन्स. लेकिन जो लोग नए होते हैं टू एनी स्पोर्ट, दे लर्न द स्पोर्ट, दे गेट एडवांटेजेस ऑफ द स्पोर्ट pretty quickly. तो do not let your age stop you, do not let your inexperience stop you, क्योंकि you have lot of things going in your favor. So that is all that I had to add to what Dr. Anu and Sujata so beautifully mentioned. I was just wondering what is left for me to say, but they very, very beautifully mentioned everything out of their experience. And I myself am 40, and I started running at the age of 33. So it's been 7 years for me. और मैंने जो start किया था, मैंने 5 kilometer से start किया था, and then I moved on over years to full marathon, ultra marathons, etc. और मेरा जो full marathon का personal best timing आया है, वो 7 साल के बाद आया मेरा timing. In fact, I had my personal best in 2023 TMM, which was 3 hours 48 minutes full marathon. तो वो मुझे 7 साल के बाद आया वो timing. तो do not be in a hurry, because ये जो sport है, it is like fine wine, it will get better with age, but you have to ensure that that wine is kept well. You take good care of the wine, and be very respectful of your body, because uh, there is some truth to the fact that everybody's body ages, and you may not be able to run the same time that you ran as a youngster. That is a part of aging, that is a part of every human being's life. But it's not that you can't run. You will be able to perform for your age category, and you will be able to perform the best for your age category. तो ये भी एक और एडवांटेज रहता है टू पार्टिसिपेट इन रेसेस. You have age bands, age categories, so you can literally be one of the top 10 in your age band. You don't have to necessarily be the top 3 out of an entire 500 mass runner. So take advantage of all these facts. Running jo hai, especially Tata Mumbai Marathon, they have lot of categories. Dream runs, they've got marathons and half marathons, senior citizen special category, senior citizen run, just to encourage all of us to take up that sport. और ऐसा नेसेसरी भी नहीं है कि यू हैव टू रन द एंटायर डिस्टेंस.
Yes.
काफी लोगों ने शायद हैल हिगडन, आई डोंट नो वेदर यू हर्ड ऑफ हैल हिगडन, वेरी फेमस कोच. काफी लोग के वॉक रन प्लान्स भी रहते हैं, दैट यू वॉक सर्टेन डिस्टेंस, रन सर्टेन डिस्टेंस, वॉक सर्टेन रन एंड रन सर्टेन, एंड यू गेट अ गुड टाइमिंग इवन विद दैट स्ट्रेटजी. तो रनिंग में काफी स्ट्रेटजीज रहती है. इट्स नॉट नेसेसरी कि आप पूरी टाइम रन करते रहो. इफ यू डिपेंड्स ऑन योर बॉडी. अगर आपका बॉडी एडजस्ट कर सकता है, यू एडजस्ट कर सकता है, यू कैन रन द एंटायर डिस्टेंस. और अगर एडजस्ट नहीं कर सकता है, देन यू कैन हैव अ डिफरेंट स्ट्रेटजी, वन वॉक रन, and you can still complete your entire distance in a good time. Power walking is a sport that is something other than endurance running, but there are a lot of power walking athletes. Priyanka Goswami, शायद आपने उनका नाम भी सुना होगा. She walks faster than we can run a half marathon. She walks faster. So, do not shy upon any load bearing or weight bearing activity for your age. It is very important as we age that we take care of our bones, we take care of our muscle, because as we age, especially after the age of 35, 40, your muscle mass, your bone density, all these things will start showing a small decline. Or running jo hai, as I said, very easy sport. As a skill, ये काफी easy रहता है. एक पैर को यहाँ, एक पैर को यहाँ. That's all that you have to do. But you have to do it for time. काफी रनर्स पूछते हैं, स्पेशली मास्टर्स रनर्स, की ना मुझे ये टाइम चाहिए, आई वांट दिस पर्टिकुलर, मुझे अपना मैराथन 4 घंटे के पहले कंप्लीट करना है. So those are time-based goals. So generally, when we are starting, when we start a new activity, we always suggest that you take as much time as you need, but don't force your body to take a certain time. मुझे खुद 7 साल लगा to get a sub 4 marathon, so I cannot expect you to get a sub 4 in under 3 months. So give yourself that time. Be patient. ये एक लाइन था डॉक्टर अनु के स्लाइड में कि patience. You really need patience with your body. And as a masters and grandmasters of running, one of the biggest advantages जो हर एक senior citizen का एक advantage रहता है, वो है mental toughness. और मैंने एक चीज हर सीनियर सिटीजन रनर में देखा है, दे टेंड टू err ऑन द साइड ऑफ कॉशन as opposed to younger folks. मतलब younger folks are little risk taking, they will take a risk. अगर इंजरी का भी रिस्क है, they will take it, but not masters runners. They tend to think, क्योंकि उनका एक wisdom रहता है, they have experience of time, they have experience of age. उनको पता रहता है कि where you need to go over and where you need to get under. And I personally feel कि ये जो उनका mental toughness का एक quotient है, that really makes them succeed in very very long distance races, जैसा ultra endurance events. So do not feel that this is not your age. Maybe this is your age to start. So definitely work up with any coach near you, any running community near you. You can get in touch with Adhata Trust. Surely they have trainers. Get somebody to understand आपका जो life है, आप running को अपने life में कैसे involve कर सकते हो. That is the most important thing. I remember Sujata mentioning 45 minutes, 3 days a week, 45 minutes. And Dr. Anu mentioning 3 days a week, 30 minutes. So you notice ये जो time होता है ये variable रहता है, because not everybody has 30 minutes, not everybody can manage 45 minutes. But you can definitely manage 20 minutes. You can start with 20, work your way to 30, work your way to 45. Maybe after a couple of months, you may be able to even hit a 1 hour mark, but start somewhere. आप 20 minutes से भी start कर सकते हो. It is not that hard. Running एक ऐसा activity है which is literally for everybody. Everybody. Okay, so do not feel shy, or definitely do not think it ये अपने age के लिए नहीं है. This is the perfect sport, the easiest sport you can take for your age. That's all I have to say, Clara. That's all I had to add to what our esteemed panelists already added.
So thank you so much. Thank you so much, Jessica. And I'm so happy today that we actually complementing each other today as panelists and as sharing information, especially for no, we started with the role model, then we said, okay, you're the role, then what is that you need, how you need to take care of your joints and then little small changes that you make in your lifestyle. After that is now, Jessica, you are the ones who are there, and actually you said that it is not, it is not that you start today and tomorrow you reach a goal. You said it took you 7 years to be where you are. So, and you are persistent. It is not that, okay, I give up. There is a new one. This one is better than me. That one is better. She is walking. I am running. Why I can't run? Why she is walking? And there's no comparison because, as you said, each body is also different. Okay. So thank you so much, Jessica. There are some questions for you, and I will come back to you. And the next panelist I would love to invite now is Dr. Balkrishnan. And Dr. Balkrishnan is a consultant psychiatrist and a physiotherapist at Bombay Hospital and a medical research center and Came Hospital. Dr. Balkrishnan will kick off the session with an engaging talk titled Heart and Mind Understanding How Running Improves Cardiovascular Health. He will dive into how running enhances heart function and oxygenates the blood, which in turn supports cognitive health by boosting memory, mental clarity, and overall brain function. So we had Dr. Balakrishnan, we had Sujata, who also talked on how she took up running at 60s, and then she says how it helped her regulate blood sugar. And also then she gave us a little insight and little research about how running and how physical exercise also helps to build new neurons. And we, after this discussion, will take up, I mean, I'm sure this is also an extended series for awareness about dementia and Alzheimer's. September 21st is the day of World Alzheimer's Day. And we would like to take this topic next, since all the panelists will be here, how all this will help to keep Alzheimer and dementia at bay. So welcome, Dr. Milan Balkrishnan, and I'm sure your inputs are going to help each one of us listening here. So we have a good audience, and each and every senior citizen, whether it's from Adhata, anybody who's listening, also those who are youngsters, please do listen to this, go through this. Even if you're not able to come now online, please take this inputs and see how we can make small little changes in our lifestyles and to build a better mental health. So Dr. Milan, welcome.
Thank you so much, and thank you for bearing with me and accommodating me towards the end. Uh, but that actually helped me sort of listen to all of these other talks, and I think very inspiring stories from Dr. Sriram, Dr. Arora about the entire how to take care of our joints, how to take care of what shoes to use, and Jessica about how she sort of put all of that together. I think again we a lot of the things that I'm going to talk about, some of them we touched upon slightly, but let's sort of explore that a little more. Uh, okay, the 100 is this slide share not visible right yet, right? 1 minute. Visible now?
Yes, visible.
Super. So, of course, like Dr. Sriram spoke about, I think this whole idea of how I think this is something that we need to talk about a lot. That, in the past, we all had this very strong, not only belief and notion, but also there was initially talk about how neurons once damaged don't recover, but now we know that, and we talk a lot about neuroplasticity, and I think that's something that we should talk about, that how the brain is now capable of regenerating neurons that are damaged. Even despite damages in some areas of the brain, the surrounding areas of the brain will take up the activity of sort of uh, responsibility of these neurons, so that they sort of support each other, and hence overall we find that the brain recovers a lot better than we imagined before. But of course, with some sort of uh, limitations to that. Just to sort of begin with sort of reflecting on, we will be talking about how running improves cardiovascular health, how it improves mental health, but we also know it helps aid weight loss, strengthens our muscles and bones, overall enhances cognitive function, improves sleep quality. I think that's something that is very important. A lot of people, especially senior citizens who are struggling with sleep, will find themselves sleeping much better. It boosts immune system also, and hence can also be in the long run protective against illnesses like cancer, because overall health is better. The cells are doing better. The immune system prevents uh, cancer cells from sort of growing and proliferating, increases the overall longevity, length of life, increases our overall energy and stamina, and promotes mental clarity. I think the most important thing that we should talk about here, which are what we talk about social benefits, the community, sense of community that there is among one senior citizens, also among runners, and when they come together, this feeling of a community, of a group, of supporting each other, and the conversations, the engagements, all of this help overall again stimulate the brain, uh, help improve mental health. And because of more stimulation, we are also increasing what we just spoke about, neuroplasticity. And so in fact, uh, when we talk about, which we will talk about later as well, that when we talk about dementia or forgetfulness, memory impairments, cognitive issues, जो एज के साथ जो जो ब्रेन चेंजेस होते हैं, उनको डिले करने के लिए it's very helpful to have this sense of community, because these interactions will trigger uh, the neuroplasticity in the brain. It will improve, it will create more connections between neurons, and hence we are more likely to sort of uh, delay cognitive decline, dementia, Alzheimer's, ये सारी चीजों को delay करने में it will definitely help. Of course, we spoke about it. Like Jessica said, you just need to get up, wear your shoes, one, two, and that's where running begins. So it's accessible, inexpensive, doesn't need any extra equipment. Now, what does running do to our heart? Right, one, it helps increase the uh, it strengthens the cardiovascular system, helps the heart pump better, helps the vessels relax better, so blood flow is promoted and is better. And so, in the long run, it will also reduce the risk of heart disease, reduce blood pressure, and decrease the risk of stroke. Now, these strokes are, and very often, when you see older brains, you will see that they have small strokes uh, in certain areas of the brain where there are small vessels, and these small strokes will cumulatively lead to uh, again memory impairment, lack of focus, concentration, uh, and these, if we can prevent these small strokes, the overall output in terms of our memory, focus, and keeping our brains younger in the long term uh, will be very significant. So overall, the heart and brain are so very closely linked. So overall, we're looking at how running will help improve heart function, so improve blood flow throughout the body, increase oxygenation throughout the body, better delivery of oxygen to the brain, to all the parts of the body, the muscles, and including the heart muscle. So it will overall strengthen the heart muscle activity as well. So uh, running overall will reduce heart heart disease very significantly. So even up to about 45% as per some newer studies. And running will increase the vascular elasticity of blood vessels. So it will make the blood vessels dilate better and hence overall lower blood pressure. So even very short duration running, like we said, it need not be long, uh, 30 minutes, 40 minutes. It could be 10, 20 minutes of regular consistent running will also improve overall heart efficiency. How how does the heart then finally, like we were saying, have its impact on the brain? Then we look at improving memory, attention, and executive functions. Executive functions are the most important uh, sort of functions that the brain must do, which makes the brain most effective. What executive functions actually means is the ability of the brain to plan things more effectively. So from doing a simple thing as what I need to say in terms of the topics about this talk to what I put out there is what is regulated by these executive functions. Or for simple things like making decisions about uh, for a for someone to decide what to cook today and what ingredients need to be available for cooking, etc. Even that is a part of how the brain functions in terms of executive functions. So any form of aerobic exercise like running will help oxygen supply improve effectively from heart to brain, and hence improve our executive functioning, memory, attention. And so we can complete tasks more effectively and we can take decisions more effectively. I think that's those are the problems that we start seeing in late age when cognitive problems start setting in, the executive functions start getting affected. Initially, of course, the memory attention gets affected, but in the long run, we may find that the executive functions start getting affected significantly. So, when you run, like I said, we are helping improve memory, focus, and reducing brain fog. I think this is something that, again, post COVID, we've been seeing a lot of people struggling with brain fog. And brain fog is a part of uh, the inattention circuit, meaning the brain not being able to put itself out there in terms of focus attention. So when the focus attention is affected, that's when brain fog becomes a problem. And that running itself will help, like I said, taking critical decisions related to executive functions, being more effective in terms of decision making and problem solving. The increasing blood flow to the brain will also especially increase, like we said, neuroplasticity. So more neurons will be regenerated in the parts of the brain that are responsible for short-term memory, such as the hippocampus and the attention areas of the brain that help sort of uh, help us pay attention and focus. So all physical activity will help, but running especially can help us promote neuroplasticity. So, like I said, that's the brain's ability to reorganize itself and keep forming new neural connections. And not only does activity increase it, but also the social element of it, which is running together, running with a group, uh, being part of a running community, and the support that comes from there also helps. So interactions that we have, discussions about thoughts, ideas that we exchange also increases neuroplasticity. So it's not only the running, it's also like re-emphasizing the need for the community. Some issues that we want to sort of think about is, if there is a person with dementia and with serious cognitive impairment, can running reverse that cognitive decline? It cannot directly reverse the cognitive decline, but it does. Medications that are available for dementia also do the same thing, which is slow down the cognitive decline. Or so if cognitive decline is due to happen in the next, that means if dementia, memory impairments, lack of attention, all of these may worsen in the next, say, 2 years, we can help push them to a period of 3 to 5 years. So we're delaying the process. And how are we delaying this process? Is by reducing inflammation in the brain. And even all of this uh, cognitive impairment is caused by neuroinflammation. So, just like when you have an injury on the hand, if there's a cut, as it heals and sort of heals itself, there will be some redness, there will be some pain. Similarly, in the brain, also, there is inflammation happening, and running will reduce the inflammation in the brain, increase the glucose and oxygen availability in those areas so that the glucose is utilized much better. And so it may not fully reverse the memory symptoms, but it can definitely help uh, delay the symptoms. And any other, like we spoke about, additional issues like stroke, etc., which may increase the risk of memory impairments, we'll be able to restrict them or delay them from happening. S- Some questions like, how frequently do you need to run? We spoke about it, 3 to 5 times a week, 20 minutes, 30 minutes. Again, it's not about the duration. You need to do it as often as possible as you can, and you need to do it for from a 20 to 40 minute period, and do it as best as you can, without sort of putting too much pressure on yourself, pressure on your knees, or hurting yourself. So taking all those care into the situation, so that we can overall again do the same things, improve our cognitive performance and plasticity. These are questions that come up often, right? Whether high intensity training is better than just endurance running. Uh, all forms of running will be useful. It's only about what is your preferred way, what is your lifestyle, what is your fitness level, and what suits you the best. There are some researchers that talk about HIIT, but they're not very consistent in saying that HIIT is better than other forms of endurance running. So how do we talk about brain benefiting from, does running benefit the brain differently? Running, like I said, just to encapsulate, provides the cardiovascular benefits to the heart itself, and also indirectly to the brain. It has a lot of benefits in terms of reducing our level of stress. It seems to be better than strength training or other exercises, because the cardiovascular aspects of it are more prominent, and those seem to have more of an impact on the brain. And like I said, in terms of preventing uh, cardiac events like heart attacks, etc., but also brain events like strokes, and reduces the risk of these strokes, which will reduce the amount of um, risk of cognitive impairment. And so your overall brain health will be in a better stage for a longer period of time. And just if the cognitive reserve, which is basically how much of our brain is active before any form of cognitive impairment sets in or dementia sets in, that really determines how slowly or how much the effect it has on the brain and on the output on how we function in the long run. So those who have higher cognitive reserve are less likely to struggle uh, with dementia. They may have symptoms related to dementia, but they're able to manage them much better. So that building or increasing cognitive reserve is something that uh, exercise and running will especially help with. When we sort of run or take care of ourselves better, like like we said, we will be improving our cognitive flexibility, improving our working memory, improving our ability to sort of our executive function. So eventually, our problem solving abilities, our ability to make critical and important decisions in life, and also improve our mood, motivation, overall energy levels will also be improved as a part of the the advantages of improving our cardiovascular health and our brain health. So overall, that's where we were. So I think let's come up with
Questions.
questions and
Yes.
we'll be ready to answer them for you.
So thank you so much, Dr. Milan, and you have really taken us through the entire scientific or the science of the subject. We come back and we would request all the panelists to be back here so then we can take the questions. So I hope Dr. Anu and Jessica also there. Yeah, thank you so much. Uh, since we are in this week where we'll be coming and we are going to create a lot of awareness about Alzheimer's, dementia, and on this, especially on the mental health. Uh, there is a study which says, as per Adhata, that almost our population for aging is like by 2050 we're going to be three times more. And now itself, when we say we are 20% of the population is senior, 8.8 million Indians are diagnosed with dementia. And that is almost 7.4% among them are 60 plus. So it's really a concern that is coming in the society. And if you go out and see, we really don't have those many care centers or dementia care centers or any awareness or any sort of programs that we run for them. And how, so I feel this is a platform where we can appeal to people about how to remain, how, what are the practices that they can do. And now if I'm saying 8 million Indians, that means that is across, it's not only 60 plus. So that also is not a small figure. It's like really a red alert for all of us. And what are these life changes, small changes that they can, sometimes we say, oh, this is not for me, this is for 60 plus. And we just try to avoid the topic. And the kind of stress the youngsters go through or the mid-age people nowadays go through, and it's coming very early. So you let me ask Dr. Millen. Dr. Millen, you think what you just showed us your slides where you're saying that running is really helpful, and it only not only just like supporting Sujata, it also helps with new neurons. And you think youngsters too should take up these exercises, especially the physical exercise, a bit seriously, and at least like what Jessica said, maybe if it's 20 minutes we need to give it to ourselves.
Yes. So with regards to for the youngsters of how we talk, if we talk about how youngsters can prevent uh, dementia can occurring in the future, we can't do it 100% because one of the most important factors there is genetic, right? The risk of dementia that's passed on from generation to generation is a significant one. But yes, in terms of all the preventive factors, the ones that are manageable, controllable, or avoidable, those we can definitely address. So when we look at all the all the sort of non-communicable diseases that we talk about, which is hypertension, diabetes. Um, these are the key ones that we can prevent, which can reduce the risk of dementia in the future. Because dementia again is multifactorial. We talk about Alzheimer's type. We talk about dementia where there are vascular factors, and the vascular factors are the preventable ones. When the Alzheimer's, we may not be able to prevent as much, but we can, for the Alzheimer's part of it, like I was talking about, building our cognitive reserve and our ability to sort of have more of a cognitive reserve can delay the onset, and also reduce the sort of impact that dementia will have on our brain. In terms of the vascular factors, definitely we exercise of any form, including running, managing our diets better. When we talk about exercise, it also reduces uh, the bad cholesterol and sort of increases the good cholesterol. So that's the HDL and LDL that will also become a factor. So youngsters definitely can look at exercise and running as a way of preventing dementia in the future.
Yes. Professor Sujata, this question is to come for you. I'm in my 70s and I want to start running. Is it possible?
Of course it is.
Yes. But
All
with-
I'd say is if you can find a running group who will support you, nothing like it, and take it slowly. As Jessica said, there's a 3K run, there's a 5K run. Take it slowly. There's no need to run a 10K, there's no need to run a 21K. Running is running. Run because you enjoy it, not because somebody is telling you to run. I think that's the most important thing. But on the whole, I would say that, any form of exercise helps in terms of getting the body moving, gets the blood moving, and makes you feel better with yourself.
that's the next question. Can cognitive benefits be gained from simple walking and running?
Yes, but not an amble. I'd say, walk with some meaningfulness, a brisk walk is great. So again, this whole thing about getting the blood moving in the body, that's what the whole exercise should be. An amble after dinner is a good idea for digestion. It keeps the blood sugar under control. But as a regular exercise, an amble isn't exactly the best form of exercise, especially if you can manage to do a brisk walk. I think that's also related with what the physical capacity of the body is. So if you are, say, between 60 and 70 and you can manage a brisk walk, please try it.
So this also answers the question is how much running is needed to reduce the risk of dementia.
I will come back to this, this whole thing about where I said this 3 days exercise, and that's shown from research that, at least this 3 days, 45 minutes, if you can manage it. And it again doesn't have to be 45 minutes at a stretch, but it helps if you can get that 45 minutes.
Professor Jay, also, since you are in the faculty and also when we are talking about geriatric mental health, there is a little awareness about this subject also on geriatric mental health as a field, as specialization. So in that, you think like these, when we are talking about dementia, any mental health problem or any issue for an elderly, is only running or is only walking can keep Alzheimer's and dementia at bay?
So I'd say there are multiple lifestyle issues that we need to keep in mind. One is networks. What are the kinds of social networks you have available? At the end of the day, we are all social people. Man is a social animal.
Yes.
And I think one of the big problems with COVID was it sliced through the
Yes.
social networks that we took for granted. And as a result, I'd say the vulnerability towards aspects of dementia has increased. It increased manifold actually during COVID. And again, I would add the other factors. So for example, we do know that loss of a spouse, especially for a couple that have been married for a long time, can create tremendous aspects of grief, which can resemble aspects of dementia. So those are again factors. How do you help people get over grief, deal with grief? Again, more the more mundane things, how do you ensure that you eat regularly?
Yes.
And eating regularly is a big important part. Again, avoiding smoking, that's a big one actually. Again, if you're seeing the number of people who are increasing, smokers aren't coming down in this country. Young people are smoking more and more. Women are smoking more.
Women is smoking.
Women are consuming more alcohol.
So the next question comes to Dr. Anu. There's a question saying that can a person with knee osteoarthritis run?
Yes, definitely. See, I'll take your earlier questions also in perspective of this.
Yes, I see.
Yeah, the question was on mental health first.
Yes.
First, let us understand there are two things, physical activity and exercise. Anything you do, आप जो भी कर रहे हैं, अगर उसमें एनर्जी यूज हो रहा है, तो वो फिजिकल एक्टिविटी है.
जी.
फिजिकल एक्टिविटी के अपने बेनिफिट हैं. Exercise is structured, it is repetitive, it is towards a specific goal, it has the requisite intensity, frequency. You can walk as much as you want. The goal is to walk. It will also give you benefits. But when you run, the benefits become more specific. So, हमारे शरीर में चाहे वो हमारा ब्रेन है या हमारे और कोई स्नायु है, हम उन पे जितना स्ट्रेस देते हैं उसके हिसाब से उनका स्ट्रेंथ बढ़ता है. ऐसे ही आपका ब्रेन भी फंक्शन करता है, लेकिन ब्रेन की एक्सरसाइज अलग तरीके से चलती है. एक नॉर्मल ह्यूमन ब्रेन यूजुअली कुछ 1200 ग्राम होता है. उम्र के साथ आपके ब्रेन का वजन कम होता जाता है और इसके अंदर कनेक्शंस हैं न्यूरॉन्स में. So these connections, about 20 billion of them, these connections, they reduce with age. And this is what makes it symptomatic. जो आप भूल जाते हैं, याद नहीं रहता, आप कुछ कॉम्प्लेक्स प्रोग्राम नहीं डिवाइस कर पाते, कुछ आपको रिकॉल नहीं हो रहा, ये सब साइंस है आपके मेमोरी के अफेक्शन के. क्या हम इसको प्रिवेंट कर सकते हैं? हम कर सकते हैं, पर कुछ गारंटी है? नहीं. लाइफ में किसी चीज की गारंटी नहीं है. हमको सिर्फ करते जाना है सही डायरेक्शन में काम. अल्जाइमर्स एक डिजीज है जिस वो इरिवर्सिबल है, वहां से हम वापस नहीं आ सकते, लेकिन माइल्ड कॉग्निटिव इम्पेयरमेंट से आ सकते हैं. हम उसको प्रिवेंट कर सकते हैं. उसके लिए ब्रेन को वर्क करना है. ब्रेन को वर्क कैसे करना है? हम फिजिकल एक्सरसाइज जब करते हैं, रनिंग जैसे, तो हम चांसेस ऑफ ब्रेन गेटिंग अफेक्टेड विद दीज प्रॉब्लम्स को डिक्रीज करते हैं. हम 100% प्रिवेंट कर सकते हैं? नहीं, लेकिन हम उनको डिक्रीज जरूर कर सकते हैं. इसके अलावा ब्रेन की स्पेसिफिक एक्सरसाइजेस हैं. जैसे हम अगर वजन के साथ मांसपेशियों की एक्सरसाइज करते हैं तो मांसपेशियों का स्ट्रेंथ बढ़ता है. ऐसे ही जब हम ब्रेन के लिए एक्सरसाइज करते हैं तो हमको उसको चैलेंजिंग एक्सरसाइज देना है, कुछ नया करना है और उसको रिपीटेशन के साथ करना है, जिससे हमारे ब्रेन का जो हिप्पोकैम्पल एरिया है, जो एज के साथ अफेक्ट होता है, हमारी लर्निंग प्लानिंग को अफेक्ट करता है, उसको हम हेल्दी रख सके. हमारी फिजिकल एक्सरसाइज ब्रेन के ब्लड फ्लो को इंक्रीज करती है, एंजियोजेनेसिस करती है, जिसको बोलते हैं नई वहां पे ब्लड वेसल्स प्रोड्यूस होते हैं और हमारे नए न्यूरॉन्स भी प्रोड्यूस होते हैं, जिसको हम न्यूरोप्लास्टिसिटी बोलते हैं. वो ये बोलता है कि न्यूरॉन्स तो हैं, हम जब काम कर रहे हैं हम एक कनेक्शन के थ्रू काम कर रहे हैं, लेकिन हम उसी काम को एक दूसरे कनेक्शन के थ्रू भी कर सकते हैं. हम दूसरे कनेक्शन को एक्टिवेट कर सकते हैं. तो आप जो ब्रेन गेम्स खेलते हैं, पजल्स करते हैं, तो आप इन कनेक्शंस को एक्टिवेट करते हैं और इससे अपनी ब्रेन की कैपेसिटी को बढ़ाते हैं. तो हम बोलते हैं फिजिकल एक्सरसाइज भी करो, रनिंग से भी ब्रेन अच्छा होएगा आपका, साथ साथ में मेंटल गेम्स करो. मेंटल गेम्स कैसी करो? आप अकाउंटेंट हैं, आप नंबर्स के साथ ही काम करते हैं, तो नंबर्स इज इजी, इट इज हैबिचुअल फॉर यू.
Dr. Anu, 1 minute to give me one space. So to just interrupt you, sorry, but I think Adhata is doing all this. Adhata is a holistic learning center, and Adhata does a lot of mental gym, all mental health programs for senior citizens, and it does psychological, mental as well as social programs for seniors.
Very good.
All under the 16 centers banners that we have, and this marathon is also one initiative for that under the physical area. Same way now we are coming with the daycare center. Next, like this Sunday, we are having a promo event at Bandra at the Cutter Road. So we are having it a promenade, and there we are going to use the drumming circles for them.
Very good.
We have a person we have a group who uses drumming as a therapy for people, for
Very
walking,
good.
for those who are coming there. So no, it is like a holistic well-being center. So we are aware that they need these programs, and so for last
So
12
if I
years
can
we
also
are
come in,
working towards this.
Clara, one of the things is, very many people talk about, Sudoku, brain
Yes,
games,
yes, absolutely.
crosswords, but again, they don't always look at physical exercise. That's
Yes,
again one
Hmm.
of the very unfortunate things that
Yeah,
is there in our culture, that, once
yes,
you hit
correct.
60 plus, you're
yes,
retired, you sit in your armchair, you can play all your word games, collect all the booty you like around the abdomen, and you live your retired life. But I
and they
don't think
restrict
that's.
your geography also. You
Oh
can't
yeah.
go here, you can't go there, you can't go up
So
outside this zone because you'll fall and it's too
I
far.
will also say that
Also
I have
restrictions,
faced lots of restrictions from my
lots
own
of
family
restrictions.
about running.
Absolutely.
I run
Obviously.
regularly on Sundays, and there's a lot of things. Are you going running today again? Yeah, I'm going running because I want to go.
Yes,
It gives me a lot of joy running near the sea.
yes,
So that
But there are
balance, ma'am,
lots of
is what is
restrictions that
required.
families put.
yes,
And I
yes.
think those are the things that many of us need to fight against.
Yes. So there needs to be a balance, and that's why the 5 days program that we run is the perfect balance of this program for
Absolutely.
5 dimensions or an aspects of aging. So my next question to
About
Jessica,
knee.
sorry,
You mentioned about the knee, those who
yes,
have arthritis.
yes, yes,
Yes, those who have arthritis can run, but see, every person is different.
yes,
Exercise is tailor-made.
yes,
Running is also tailor-made. So
yes,
you have to see what is the equipment that I have.
yes,
So you want to run, so prepare your body for that.
yes,
Work on your aerobic capacity, get the right kind of footwear, do core muscle exercises so that they can give power to your lower extremities. वर्क ऑन योर नी मसल्स, अपने घुटने के स्नायु को स्ट्रॉन्ग करिए, हिप के स्नायु को स्ट्रॉन्ग करिए, पैर को सपोर्ट दीजिए एक बराबर से फुटवेयर से. स्टार्ट विद वॉकिंग. सो फर्स्ट स्टेप फर्स्ट. Don't go to running if you are deconditioned. You have never run in your life. Today you are 60 and you suddenly want to run. Prepare yourself. You
yes.
can run. Everybody can run. But then prepare, take
सही है.
all the precautions, and then go about it.
एब्सोल्युटली. तो आप कहते हैं कि जो भी करना है आपको धीरे धीरे से करना है, आहिस्ता आहिस्ता आगे बढ़ना, एक ही बार आप बहुत बड़ा स्टेप से बहुत बड़ा कदम नहीं ले सकते. सो जैसे कि द नेक्स्ट क्वेश्चन टू यू इज व्हेन यू स्टार्ट अ रेस और इफ यू स्टार्ट रनिंग, is it necessary that you do warm up exercises before and after the race, or you straight away start running? So that was the question that's gonna come up.
Yes, that is something, even runners, they tend to skip, even seasoned runners, but absolutely necessary. Warm up is absolutely necessary before your run. It simply signals your body that you are about to engage in a high impact activity. So you need to prepare your joints, you need to prepare your nervous system before you start any vigorous activity. When it comes to ending it, we generally don't warm up again. We call it warm down.
Warm
I
down,
think the
yeah.
question was a warm
Sure,
down.
it's a
So
warm
we
down, yeah.
generally go into warm down mode
Absolutely.
after the running. That is to signal your body to start its recovery process and to help it relax because it has gone through a lot of contraction,
Yes.
gone through a lot of impact. So this generally includes some passive stretching that we do towards the end, the warm down. Your warm up would include, active movements, active stretches, and something that can get your fluids to move
Yeah,
before you
because
start moving. Okay.
yeah. So Jessica, because why I'm coming here is we have the senior run, and that's 4.2 kilometers. So what happens? They start and they come back. Then my question is whether they do another little warm down, rest, and then eat, or sometimes they come and they immediately look out for something. Then I said, no, you need to wait for some time, calm down, listen to the instruction of the Zumba one or the exercise who's trying to bring your heartbeat to normal. And then if you want to go for a cup of coffee or you want to pick up some snack, but give your body that cooling period. So that's why I put this question, and there was a question there exactly. The next
Yes.
question is, and this is really one thing which is very
Clara, can I just come in on this, please?
sorry.
Sorry.
Yes.
So, in all the runs that I've done, I always find that, we don't spend enough time cooling down.
Yeah.
There is the Zumba, there will be the,
Yes.
the And again, frankly speaking, as far as I'm concerned, Zumba is pretty useless. Okay, I think there's a lot more that you can do more in terms of stretches and things like that to get you in tune for the race. And unfortunately, we don't spend enough time in terms of the cool down. The
Yes.
other thing before the snacks and the rest of it is hydration.
Yes.
Because one of the things that's extremely important for all of us to look at is, how do we hydrate ourselves? Again, whether you're going to keep an electrolyte, a drink with you, whether you're going to carry your water bottle with you, all of those things I feel are very important for us to keep in mind when we run. So, because as you age, you also don't tend to drink as much water as you need to because you don't want to go to the loo very often. But unfortunately, that has its other effects in terms of making you feel more exhausted, causing cramping and things like that. So, uh, getting people to recognize the need for hydration during the run and after the run, extremely important.
Yes, I think that's a very valid point of view, Professor. Also, you should listen to your body. Even when you're walking and when you're running, suppose if you feel, okay, you can't, just because somebody's running next to you, you don't know have to run. If your body is saying, no, you can't do it, you need that 1 minute there, please take it. So then you are actually listening to the call of your body, and then you're not trying to push or actually punish for her, because then there is a touch. Then there is something which we cannot really it's something which is unavoidable. So hydrate yourself, give yourself that rest. If you're okay, I can do this much, okay, this is your limit, and listen to your body what it is saying. Pick up the clues and say, okay, this is what I can do. Okay, so thank you so much
Also,
for bringing that point about hydration. That was really good. And
Also,
I
Clara,
think we give water. Yeah.
I would just like to add there's a technical reason also why we warm down and
Yeah.
you just don't suddenly stop. So,
Yeah.
some people would just suddenly stop after the
Yes.
run and then they just go and eat. So there is a technical reason why we include a routine and we slowly get our heart rate down because you're still in motion. Your body is
Yeah.
still in motion and your blood will be accumulating towards all the extremities that are using that blood. So you need that blood to get circulating back into the rest of the body in a timely manner. So your heart rate just suddenly should not come to a stop. Okay, you need your heart rate to settle to its resting value slowly, which is why we give that warm down period. And the second reason why this is necessary is because any digestion it's called a rest and digest period, right? I mean, when you're running, you are in a sympathetic mode, whereas digestion is a parasympathetic. These are technical words, but it's actually a rest and digest state. You need to be in a restful state when you're eating and trying to digest something well, which is why you need to give yourself that time to actually cool down, get to a rested heart state, and then you can go ahead and then have your buffet that you need to have at the end of the race.
Okay, so Dr. Milan, can I have when the Professor Sujata and Jessica were talking just now, I thought of this question to you. Is suppose I'm running the race and I'm already in the marathon and I'm already crossed 1 or 2 kilometers and I start feeling uneasy. Something, then you feel okay, whether I should go ahead or no. At that 1 minute, what is the call that you need to take?
This, I think, this is a question also where, like you pointed out, knowing your body is very important because this may mean different things for different people, and it could be from a more worrisome sort of situation where there may be a real physical problem at hand to this sort of sense of your body not feeling ready, feeling very exhausted, or not being able to sort of go through with it. So I think that is something that a runner will know from training, from running for a period of time, what the body is saying when something happens in the body. But in case of doubt, and in case that the person feels that things are not routine or seem to be out of the blue, it's better to sort of stop and seek some kind of medical help.
Thank you, Doctor. The last question I think we have, and we're already just 5 minutes away. Uh, as you know, dementia affects memory, thinking, and our behavior. So it interferes with our daily life and our social interactions. That means it makes us more vulnerable. It makes us more dependent. And at later stage, there is more dependency. So here the role of a caregiver comes in. How do you perceive this role? And Professor Sujata and all who are here, Dr. Balakrishnan, the mental well-being of this caregiver now becomes more important than the person who is suffering with dementia themselves. So now when we're talking about, running, we're talking about physical exercise, we're talking about how important is this for a caregiver?
Mm. So I think that when we talk about dementia and when we talk about dementia, that's progressing. I think, like you pointed out, the caregivers well-being becomes very, very important. A lot of times I find myself telling patients that currently what we're trying to do in terms of the dementia is limited, but we need to make sure that we can find some sort of a balance where we treat enough so that the caregiver can also manage the patient with dementia effectively. And it gets even more difficult when the caregivers are usually of the similar age
Yeah.
as that of people with dementia. So when it's the spouse, it's usually becomes very overwhelming. Usually children are not around, and there is a risk of burnout among. And not only is there a risk, there's a very real uh, sort of situation where we see a lot of spouses burning out or even children burning out, and that leading to even issues of aggression towards the person with dementia. So I think that again for and being able to find time for self for the caregiver can be something very sort of important yet very difficult. And also the caregiver tends to go through a lot of guilt when they try to find time for themselves, because that's another issue that they face, that if I am taking care of myself and I'm even for some time leaving the person with dementia with an external caretaker or a paid caretaker, then that comes with a lot of issues of guilt. So I think that those are things that we need to build awareness for, that the caregiver needs self care. The caregiver needs to find this time to either exercise, run, do things that they enjoy, so that they can in fact also pointing out to the caregiver that that is what will make them capable of taking care of this person with dementia much longer. So I think these are some things that we need to reaffirm and reiterate with patients with dementia and their caregivers. I think inputs
So
from everyone is
I'll just come in that, we need to also move away from the belief that self-care is selfish.
Yes,
Self-care is actually essential.
essential.
And caregivers need to understand that their own self-care, paying attention to their own mental health, will make them better caregivers.
Yes,
And that is something that actually, it's a cultural thing also, I would say, this thing about, giving, the martyr aspect that comes in. It's a very strong cultural aspect, which again, family is very good at making caregivers feel very guilty about, if they take some time out to do something which is seen as relaxing and leaving for them and leaving the patient with somebody else. The other thing I would say is that caregiving of people with dementia is eventually a community thing. And that's where I feel, organizations like yours, Adhata, can play a very good and actually do play a very good role in terms of supporting both patients and caregivers. So, for example, bringing together a community of caregivers to share just stories about, look, how they're managing. I think that's extremely important and useful. And those are things that actually, that's another further track that Adhata can take up in terms of right now. Yes, we're working with people who are older adults, silvering seniors. but also look at maybe separately wellness groups for caregivers. And they could also be neighborhood, clubs where caregivers come together just to share. They very often, especially when you're looking at older women caring for older men, there's nobody with whom they can talk. They can't talk to their children openly about what they're going through. Very many times they don't have friends of their own. It's a very genuine problem.
The genuine problem. So, as you mentioned, Professor, one of our centers, we have a person coming. So
Yeah.
the husband comes, and initially when they came, they both used to sit, and for I think next 3-4 minutes she didn't talk to anybody. Just to put her head down and sit. But today, the she comes, he leaves her there, and she sits. She's surrounded by all other members, and she's more active than anybody else. Before the prayers are just when the prayer is over, she'll walk up to the coordinator, my sheet of work. So this is, we're talking about community, and then a husband is getting that respite.
Yeah.
From caregiving, which can then finally eventually give more healthy caregiving and better quality of caregiving. So thank you so much for this. And I also want to mention here that I have done a master's program in Spark of Life Philosophy for Dementia from Dementia Care International, and they also talk. They have a beautiful model of care which I am using in my centers for dementia care. So we do have in the center, sometimes, it's a myth, they don't talk about it, but we do have people who suffer and then who come over there, and then we take care of them. And we use this model of care because we know there are many reasons why do you get it. But we are working in this, how to be, we are using all preventive measures so it doesn't deteriorate further. And it is helping because all this art, the DIYs and these music therapies is helping the person there, and is helping the caregiver also. And also they believe that new neurons are formed. So when we say that the Spark of Life model care takes care of dementia, but it also believes in dementia. So we know that it is not lost. We can see the gleam in that eye of that person, that of his existence to be loved and to be taken care of. So with this, once again, a big thank you to all of my panelists for joining today's session for this knowledge series, and giving a very strong message to stay active, stay healthy, keep running for your body and for your brain. Have a wonderful evening, everyone. Thank you so much for this, because I believe what is good for your heart is good for your brains too. Thank you so
Thank
much. Thank you
Thank
for
you so
Adhata.
much. Thank you. It's been a pleasure.
Thank you.